President Trump plans to hold a news conference to discuss the coronavirus and his administration's preparations to keep it from becoming widespread in our country later tonight. We are expecting to hear from the president at 6:30. Of course, we will be covering that. And the coronavirus has infected thousands of people around the world. To prevent the chances of it spreading, international travelers are being screened and at times even quarantined.
It is not a matter of if more cases of coronavirus will hit. It is a matter of when it will happen. Many people are concerned and some are even panicked. Our medical reporter Rosemarie Beltz is in the studio now to verify what you need to know about the coronavirus. Rose.
Many people have questions about the coronavirus. I'm here to answer some of those questions. We turn to three credible sources: the World Health Organization, FDA, and CDC. First question: do flu and pneumonia vaccines protect you against the new coronavirus? No, they don't. The virus is different from other viruses and needs its own vaccine. Researchers are working to develop a vaccine that will specifically target the new coronavirus. In the meantime, the flu and pneumonia vaccine are recommended to boost your immune system and protect your overall health. Second question: will antibiotics prevent or cure the new coronavirus? No, antibiotics are not used to treat any virus. An example of another virus is the flu. Last question: should I buy or be wearing a mask? Will it protect me from getting the coronavirus? No, there's just not enough evidence that shows a mask will protect healthy people from getting sick. However, if you are sick, a mask can help some germs from spreading. But remember, this coronavirus is still a mystery. This information can evolve as doctors learn more. While the virus appears to be moving from person to person, health officials don't understand how easily this virus is being spread or how it may affect people. So right now, doctors do know the best way to protect yourself and the people around you, I've said it a lot, is to wash your hands, right? So we do know that.
So last night, yesterday, with the new news, a lot of people were getting upset, but you said it's really nothing new. That they said that, you know, the virus very well will come here. It's just a matter of time, and that we should be prepared to have time off work or work remotely or take precautions. But really, it's nothing breaking news as far as America is concerned.
Well, from the very beginning, when things like this happen, what we do in the United States is to try to, of course, prevent it and stop it, but also sometimes we can't do that, right? We have a lot of people traveling, but also to slow it down, slow things down so we can line up systems here. So the way it was presented, it made it seem like new information, but I know firsthand that medical professionals have already, hospitals have been, for weeks now, have been preparing for things like this to happen.
We're doing this entire segment because we do not want you at home to panic.
Right, and exactly. And I will tell you this too, just from talking to medical professionals today, friends of mine, people I'll be working with next week, is that, you know, there's a fine line. We don't want people to panic, but you also don't want people to underreact either. You want like a real sense of what's going on. And if it makes anybody feel better at home, it's true. There's a lot of gaps. And we don't know things just like you don't know things. So,
and on that note, I want to talk about something you and I talked about. I've gotten a lot of questions from folks at home saying, how is this killing people? I don't understand. So I asked you, and you said the truth is, we don't know. Is it killing them with, you know, respiratory failure or heart failure? Or, you know, what is it? Is it pneumonia? What is it that's actually making it fatal?
Well, we don't know. And I know even within some of my coworkers are, you know, we're having questions about which vaccines either we should get and what we, you know, but at the end of it is a respiratory virus, right? Okay. And it's so at the end, respiratory, lung, you go into acute respiratory distress. But what's happening in between, we really don't know because there's so many gaps in the reporting. I mean, that's just where we are at this point.
Well, hopefully there'll be some clarification from the president tonight at 6:30. Rosemarie Beltz, thank you so much.
For making us all feel better. We appreciate it. More Friends at 5 up after the break.